Hello and welcome back to Health Source Ellettsville. Pleased to have you come back. It's always exciting for me to explain patients' problems to them, where they may be coming from. We're going to finish our exam today. Any orthopedic or neurological type checks that we have to do, we'll get them completed. You will see your x-rays. But in order for you to understand really what you're looking at, I like to tell you something about those x-rays and some basics so you understand what normal is. Because if you understand what normal is, you understand how bad of a problem you may or may not have. So that's all included in your report of findings. And we take care of three types of cases in our office here. Those that are new problems, old problems, and unfortunately permanent problems. The permanent problems are permanent problems, and they're very, very unfortunately. Hopefully you don't have those. New problems and old problems are what we can deal with. We can make changes in you. So before we go into that, I want to tell you a little bit about X-ray. X-ray is actually a shadow of a three-dimensional structure onto a two-dimensional plate. So a shadow will reveal certain things. And in order for you to understand how the bones that we'll be looking at change, I'm going to grab the spine. And this spine here, the normal spine, should have four curves. We actually have bone, disc, bone, disc. And a side view of the spine would be like this. And this is what we're going to talk about first, a side view of the spine. So here we have two blown up big vertebrae here, and the spinous processes are in the back. They come out this way. The disc sits in the center. And a good, normal, healthy person will have a plump, open disc, and those edges of the vertebra will be nice and sharp, and they'll be equidistant just about throughout. The borders will be nice and straight. However, if your problem is older, you'll have some development of some osteoarthritis. This is not necessarily rheumatoid arthritis, and arthritis is only a compensation to old injuries and especially malalignment. Just like the tires of your car. If they're misaligned for a long period of time, they're going to wear down and not last. The body's the same way, but it tries to adapt. So those nice square vertebrae that were once here now have arthritic spurring, a thin disc, which then gets pushed out in bulges back into a neural opening. Again, this is where the nerves come out. So again, these are the things we're looking for, and I'll discuss them with you when I show you your x-rays. But I do want you to know about your pelvis. Your pelvis is an important part of the whole structure, which actually starts from the ground up. Your feet start everything. And if I've already done a scan of your feet, I've shown you some problems there, or I've said you have near normal or normal fit foot posture. So if we take a spine and look at the pelvis, and remember, X-ray is a shadow. So when I show you your pelvis and your lower back, of course we want it to be relatively straight in this area. If it's twisted off to the side, and the pelvis is forward, these holes down here will appear very large from top to bottom. Normal holes, these are called obturators, should be about almond shaped. If it goes backwards, those holes are going to get squinty and very small, slanted. And of course they can go externally and internally. And we'll discuss that when we show you your pictures. So what are we doing with all this X-ray stuff? We want to assess what potential you have for getting well. I know your goals are to get well. Whatever condition you came in with, whatever you can't do in your life, that's important to you. We want to be able to restore that in your spine to a more normal, functional state so that you can do the things you want to do when you want to do them. That's what living in life's all about. So our goals are, like yours, to not only get you feeling better, but see if you have the potential to really be better. I don't want to be a Band-Aid care person for you. I want to get you involved. Doctor means one thing. Doctor means teacher. So when we take care of you and tell you about your problems, we not only want to take care of you and get you to a state where we can start cutting you loose and doing things on your own, but to continue you to help yourself. And so we